Welcome everybody to our Engage Track 2 webinar, Engaging Patients and Families to Prevent Infections. This is Boris from HQI, and I'm glad to have a good number of people on the webinar. As you know, this is Track 2, just to avoid any confusion. We are providing advanced learning and exchange opportunities for those hospitals and systems that are ready to deepen their kind of existing achievements on patient-family engagement. And today, this is our third deep dive into engaging families with our safety partners, specifically around the areas of harm that can affect people in the hospital. And today it focuses on before we go on, logistical information about today's webinar. We are recording the webinar for future reference. We will have all the lines unmuted. That's kind of our thing with Engage. We want to have, by default, everybody unmuted just so that we can promote interaction. And because of that, we ask that you please be mindful of any background noise that may come to us on your end. And you can mute your own line if you need to. I believe if you don't have a mute button on your phone, you can mute by dialing 4 and star. And then again, star 4 and star again to unmute. There are some handy tools, and one that we tend to use on the webinar is the chat function, and you can direct your chat to any individual person or everybody as a whole group. And kind of like before, I would love to have you guys chat in right now. If anybody is attending as part of a group, just put your name in so that we know who is a part of the webinar today. And if your name shows up under participants, that means that you've logged in as yourself. You don't need to do that. But anybody who is there whose name doesn't show up under participants list, please just chat the name. And I'll want to show you the full schedule. You know about this. This is our full schedule. We're kind of almost midway through our series. We have a member portal where you have records, recordings, and all the documents and presentations from previous webinars. So if you missed any, you can get content there. And today we have an approval for continuing education for quality nursing and executives. And to get those credits, we ask that you, at the end of the webinar, click on the evaluation link that we'll provide and just indicate the information about your requested CEs. We also have done a number of coaching calls, and we're completely available to you for coaching as well going forward in applying any of the principles and tools and methods that Karen and Mary are covering in our webinars. And two dates that we have identified for subsequent coaching opportunities are June 23rd and August 4th. Tentatively from 10 to 3 are the hours that we'd like to schedule those coaching calls, and there will be a prompt at the end, but you can call Asma to schedule your coaching call with Karen and Mary. And finally, I just want to mention briefly, we want you to keep your calendars or pencil in your calendars the capstone event for Friday, September 16th. It will be hosted by Sutter in Northern California in Fairfield, and it will provide the program closure and a great deal of learning and exchange around family engagement, gathering both Track 1, which is a number of hospitals that are implementing patient-family advisory councils as we speak, and Track 2, all of us working on safety events and preventing safety events through engagement. So we'll bring everybody together and have a really nice day for everybody to exchange and learn from each other. On September 16th, HQI will be able to provide some travel support for those that are traveling a distance, and we define that as more than 100 miles round trip. So more on that to come. But for now, if you would just hold your calendars open on September 16th, that would be fantastic. And here are the topics that we're excited ahead with Callahan 2.0, and a number of you are working on a number of these safety topics, and with the blue arrows, we just wanted to indicate those safety topics that are also being covered in our Engage Track 2 webinars. The one that we're covering today is on infections, and obviously a number of these are hospital-related infections. And the objectives for today are to obtain know-how so that you can feel confident about constructing practical tools for engaging patients and families in infections, to review sample engagement tools that Karen and Mary are going to offer you, and as well as others, and to have some discussion about communication strategies that can activate the family's actual use of the tools that you may be designing. And here's our friendly program team. We unfortunately no longer have Daniel amidst us, but we have been joined by Asma, who is our admin par excellence in HQI. So we've got Asma supporting our webinars. And Priscilla is sort of in the background in case we need her. But here's the core team, of course, prominently up there, Karen and Mary as our partners, consultants, and subject matter experts. And here's an introduction to this first part of the webinar, where we the coaching calls that we've had prompted us to really see if some of you would be able to share with the others any sparks of creativity or initiative that you may be where you may be designing and going forward with any kind of project related to Engage Track 2 and safety prevention, safety partnering with patients and families on safety. We have Barton Health in South Lake Tahoe. I know they're working on some exciting things, and they're wanted to share with the rest of us what they're working on in June. So in June, stay tuned for their updates. And we'll open up for any of you that want to share impromptu, but I wanted to give an opportunity today to Cottage Health and Scott Shum, who is their Service Excellence Director, and Karen Lutz, who is the Vice President of Safety and Quality, to share some really exciting news about a project that they're implementing and thinking of implementing, that was in part sort of resurrected by our conversation in Engage. So with that, Sharon and Scott, or whoever from Cottage, if you would be willing to share a few words about what you're working on.
Good afternoon, everybody. This is Scott Shum, Service Excellence Consultant for Cottage Health, and I have with me Sharon Lutz, who is our Vice President of Quality. And I want to say in the beginning that you might hear some background noise because we have construction going on, so I apologize in advance for that. What we want to share with you today is about a patient discharge folder. And Boris, if you wouldn't mind advancing to the next slide. This is basically a picture of the folder that we use. This is the front and the back, and I'll talk a little bit more about that. The genesis of this patient discharge folder really started about 3 years ago when we at Cottage Health we were looking for ways to help patients and their support people to do a better job with self-management and skills centering around medication management, condition management, didn't like that one, no, and patient confidence. So, we attended various conferences, look at, various best practices that are out there. And we attended an AHRQ conference where they discussed about this particular folder that was used by Mass General, and they tested it and found that they have tremendous improvement using that as an anchor for discussion process where you could be utilized cross-disciplinary, during the patient's entire stay. So we brought this back, and we're fortunate that our case management really and nursing team really adopted this. And at the same time, we're going forward with medication teach back. So that was a really ideal time to have a central place for patients' information and to have that be the anchor for discussion during their stay. So you can see on the back there's a bit of a checklist, and you get a better picture in a separate slides. Boris, if you wouldn't mind. So we open up the flap. Basically, we have different tabs, so it accommodates various departments. You talk about there's a slot for the medication. So when we go in and do the teach back, the nurse can kind of direct to this folder as kind of a clearinghouse, and also have a place for them to make sure to remind them to talk about being able to make appointments, follow-up schedule, any kind of education that we provide for the patient about their condition. There's a slot for that as well. And also it's being utilized by our nutrition department when we have our nutrition specialists going in and talk about their diet and lifestyle management. So there's information that they could also put in there as well. And also thinking long term for the future with the EHR. So there the discharge summary nicely printed versus the old version with handwritten, and also an entire tab talk just about going through the discharge checklist. And then on the top there, you see the sort of the road, the path to discharge. So the idea is we want to be able to make sure that we talk about discharge right at the very beginning. So every touch point, whether it's the therapist, whether it's the pharmacist, they are able to again point to this folder, pull it out, and address the importance for them to have everything, all the information at the patient, and be able to do some teach back and education centered around that. So next slide, please. So this is a better look at the back of the folder. As you can see, we have a blow up of the checklist. So these are the things that I think previously in other webinars that Karen had discussed. Having a checklist is really powerful, not only for the patient and their caregivers, but also for us as provider to be able to just let's go on that checklist. Do you have all the different support? And if we miss anything, that we're able to go back and reference that, or go back to the appropriate staff or department, say, hey, this person didn't get educated on the medication, or they feel that they need more education on that, so that we can kind of help each other out with that. So that's the purpose of having that kind of centralized checklist in the back there. So that's in a nutshell what the folder is all about. So what we're doing actually now, we had been using this for a little bit over a year and a half. What we're doing since the Engage project, now I have to compete with the drill, so I hope I'm going to speak a little bit louder, is that we want to test to make sure that we're still using this as the anchor for the conversation, for the education. So we're doing a little test, a pilot program with our case management, so that we're going to get some baseline data to see on the day of discharge how many people are actually familiar with this folder and familiar with the information that should be contained in there. And then from there, we're going to be able to test and see if we change our scripting, change the way that we approach when we first meet the patient, and be able to use the folder as an active process instead of kind of passive. But here's the folder with information versus here's your medication checklist. Make sure that you refer to that if you don't understand. And the inside flap, there's a little folder where our staff could put their cards. So after discharge, they have questions. They could also call this person. It's a way to make sure that they have the appropriate help when they transition from the hospital to home. So that's kind of in a nutshell. Hopefully we'll get some more information for the group once we test the pilot program in terms of how, making sure that it's being used appropriately. I think that's true of any kind of a new program, or at some point, that consistency will degrade, and we want to make sure that that's not the case. And we have a certain hypothesis we want to test, and if it is, then I think we could make some changes to again turn that folder as the anchor for discussion. And that's it in a nutshell. If there's any questions.
Great, Scott. Thank you so much. And everybody is unmuted, so you should just feel free to either chat in your questions or comments, or you can speak up on the phone.
Scott, this is Mary Foley. I'm really impressed with this, and just want to congratulate your team on the, the work that you've put into it. Is this something that you see having an electronic capacity at some point?
Probably not right now. We're converting to Cottage Epic, so we have to see all the capabilities and how it's going to be integrated with this folder before we make that drastic change. There might be, at some point.
Yeah, right Karen now. And I, when we meet with a number of hospitals, they talk about their patient education portals that they make available, and often say that they would, prefer to use an electronic method. I'm not sure everyone's ready for, electronic only. So I'm still a paper and pen person. I think you have a great idea. But I was just curious if you were, getting any of those requests or had that.
In that sense, actually, that's designed to be integrated with that when we fully convert. So the nursing staff or any of our staff can discuss, this is how you sign on. This is kind of the clearinghouse for all your health information. So actually, we're going to teach to that as well. So depending on the preference, so if you prefer electronic, it's there. But there are certain things some people like to have that, in their hands. So we also can provide that as well.
For sure. Thank you very much.
I have another question. This is Karen. When you create your scripting, and I'm sure that you will, about how you share this folder with the patients, will you also have a script for sharing it with the family members who are there and have a way to sort of identify those family member care partners who are most likely to be on it?
In fact, we already designed that scripting to be so not just the patient, but whoever's designated as the spokesperson, support personnel, to make sure that they are an integral part of that. So the scripting is very broad in that sense, depending on who's going to be doing the understanding, the education, and to be able to provide a teach back as well if necessary.
Oh, good.
This is a great example, Scott and Sharon. Congratulations again, and of course this stems out of your very diligent lean process and very deliberate method of designing and creating things that make sense in your environments. And we are going to stay tuned in as you pilot test it and refine it and tweak it, and really look forward to seeing where you end with this. And of course, then in my mind, it's always like you have this wonderful checklist. Be sure that you know your name and know the name of all the meds and how to take care of yourself. And then if you have any questions, you ask your nurse. And so that's a big promise, and it's an important promise. But to me, it also just indicates this need to have absolute integration of the tool with the processes in the hospital so that the staff can actually live up to the promise that you're making to all your patients. And it's exciting, and at the same time, I also know that it's easy to underestimate and not as easily done as it may seem to on the surface. So great job, and looking forward to hearing about it some more.
Thank you. Thanks for the opportunity to present.
Well, thank you. I was really excited to hear that you were moving this along. Thank you.
And now I think we are ready for Mary and Karen. If you guys want to take it over and you can advance your own slides, I will not touch them anymore. And take it over.
Thank you, Boris. Today, Boris did mention the objectives and the learning goals, and we're following the format pretty much that we have for all the other webinars, and we would appreciate your filling out your evaluations afterwards. And as Boris mentioned, please speak up. We'd really love to hear your thoughts and questions. Today, as Boris mentioned, we are partnering with patients' families to prevent infection. And this is the creepiest photo that I could find to help illustrate that we are working diligently to eradicate something that we can't see. And so I think that's one reason why it's so easy to sort of take shortcuts on the very basic first commandment of preventing infection, which is hand washing, because, our hands look clean. But if we could visualize everything that's actually going on, and I thought maybe this photo would really make an impression. So, one of the reasons, of course, why we are so concerned about hand hygiene first and foremost is that it's the number one way. And we also know the reason why we're even having to have this webinar today and why we've invested so much in creating tools for family members so that they can be literally trained as your allies, as your army to help prevent infection. Because preventing infection is just sweating the details, literally. It doesn't take a very high order of education or even information processing ability. It's very, very simple hygiene. The Joint Commission Speak Up campaign encourages patients to ask about hand washing, but yet doing so is largely perceived as a risk and to the doctor-patient relationship. And I think a lot of providers would say, oh, you know what, that's not really realistic. Well, from the patient's and family's point of view, it's very, very difficult to actually be vigilant and to speak up. So that's why we've created some tools that facilitate that, and to also promote hand washing as something that can be part of the culture. One of our advisors is Philip Carling, who is on faculty at the at Boston University, and he is sort of the gatekeeper, for keeping surfaces as clean. And we completely agree with him, is that oftentimes the Speak Up message about hand washing overshadows the other messaging that we need to communicate, is that germs don't travel just on hands, but they're everywhere. They're on the little buttons for the elevators. They're on the bed rails. They're on the trays. They're on the tray tables. And so I think I wanted Mary to jump in here and just show the power of using checklists and the proper cleaning materials to prevent infection from her own experience. Mary, would you mind?
No, not at all. That actually is a picture of me in my caregiver role. And I had been working with Karen for about a year and, became truly a believer. I had the nursing knowledge about infection prevention, but I became a believer in the role that an active family or care partner can play in adding another layer of protection. My partner, Catherine, has a lymphoma and went through 6 hospital stays of 6 to 7 days each for chemo, and then another 3 weeks for a stem cell transplant. I'm happy to say she's in remission and working hard and doing well, and we're having a good life. But each and every visit to the hospital, before she would even undress, she stood in the doorway and waited for me to clean and clean and clean every surface of the room and the hidden areas of the room, inside the tray table. Usually you find toothpaste, but if you find toothpaste, you've also found some germs. And we were very fastidious. She had, 0 white count, 0 platelets, couldn't afford an infection and had none during the course of her care, not because of me, but everyone was vigilant. But I had, as a caregiver and a nurse, I had the confidence on where to find the gloves, where to find the good, bleach products. I didn't hesitate to get in and do it. I knew how rooms worked. I knew where the surfaces were. And I can tell you, only one time did anyone challenge me for doing this. And it was a nurse who said, "Why are you doing this? Don't you trust us? What's wrong with you?" And I said, "We trust, but, we're doing an extra layer of cleaning, and Catherine won't even, get ready and get in bed until this is completed." And she became a very strong advocate for Catherine's care, was an excellent nurse. And I thought, I'm hoping she took away from that rather than challenge a family member, it would be, you should welcome them. And I just know how risk-taking that is for people who don't have the comfort level of saying, I know where things are, I'll do this myself. And and when challenged, would shrink away from doing something that's so incredibly meaningful. And in a travel environment, when we traveled, Catherine wore gloves and a mask, and people were weirded out by it. And I just, it was a barrier, and sometimes I had to explain to people when they gave her the double look. And I look at people now when I'm traveling, and I see folks who clearly are vulnerable, are immune suppressed, and are trying their very best to live and to protect themselves. So I definitely have emerged from this with a brand new set of eyes and a much deeper appreciation for not only how important it is, but how hard it is for people to do. And I think of lay people and the challenges they have just understanding our crazy system and feeling welcome when they walk in the door with their loved ones. So thanks, Karen. I just think it was important to share this role.
Yeah, and I think it's a very good story to illustrate why Mary and I and our team focus as much on hand washing as we do on surface cleaning, and on how to share information about just the very fundamentals of infection and, what they can do in order to support a very, very clean environment. And in fact, there are, I have to admit, we've had some pushback because a lot of times care providers feel sheepish about asking people to do things that they consider to be, cleaning. I mean, who wants to ask anybody to do cleaning? And care providers in general, I think, are very gracious and think, oh, these people are guests in our place, how can we ask them to do this? But people in general who are bedside with their family members just don't know what to do. And if you give someone something productive to do, it feels very, very good. It channels a lot of anxiety into, good use and obviously good outcomes, because preventing infection is number one. I wanted to go back to this slide for a second. See the link on the bottom of the slide, and all of you will have this deck, in the portal. But this is a link to the guide that Mary and I are sharing with you that has many, many more details than we can possibly cover in this hour. And it covers all of the sections, all of the topics that we've had so far and that we will have. So we really encourage you to go through this guide. It talks specifics. It shows specific checklists that you can share with patients and families around this issue of hand hygiene and surface cleaning. And I hope you'll go there. One of the things that we'd like to quickly review, and Mary, do you want to take this over? This is our how we typically approach sharing information and partnering with families. It's just a quick review.
Yeah, thanks, Karen. And, we have consistently used this because it's been shown that, learning techniques, particularly with adults, it requires sharing information at multiple levels. And one, of course, is to share facts so that you give people information, about, the presence of infectious agents, where they are, and the potential for harm. But then because you want to really approach somebody at their heart, you are going to help to define the implications of these potential infectious agents, for their loved one, for their person that they're the care partner for. But more importantly, and I think that's why this whole focus that Engage is involved in, is so what do you do with it? We really want to give people some meaningful actions and tools and steps that they can take so that they don't just sit there, watching the germs circulate around and be scared to death, but that they can become a line of defense and a protector and actually protect themselves, because what goes on, as you know, in your hospital settings also walks out the door with every single one of you and every single one of your visitors. So the potential for the transmission of C. diff and MRSA is just scary, because they could become community acquired. So I think we really want to attack all of these issues in these three ways, and it has been shown to be one of the more effective ways to teach.
Yeah, and so today we are going to really focus on the tools, and I took this picture actually in my brother's ICU room last summer. He was in a cardiac ICU, and the first thing as you walked into the door was this basin, and there were two tubs, really big tubs. One had alcohol wipes in it, and the other had bleach wipes in it. And they were completely full. I, of course, was delighted to see those there because I had the checklist already in my brain, firmly planted, of all of the surface areas that I proceeded to wipe down thoroughly. Just like Mary, I scrubbed that room with both bleach wipes and alcohol wipes because I knew I could decontaminate all of the surfaces. I also used the gel at the door to wash my brother's hands quite frequently. I asked him not to shake hands with anyone who came in and that would not be impolite. After everyone came in the room and brushed against any surface or touched any surface, I re-wiped them again because the minute, as you know, they leave, germs can be transmitted on clothing and other hands. And so while I had the checklist in my brain from creating one of the great assets or one of the great additions that could be made to this nice counter would be a checklist so that patients or family members would know what to do with these supplies. Now, when I say checklist, it's kind of a shorthand way of talking about presenting information in a very quick bulleted format. So in this case, our checklists are the ones that we've come up with at Partner Health are in the form of, this is a little trifold brochure, and this is the front side of it. In every case we follow, we share facts, appealing to the head, and in this case, we talk about what is infection, who's at risk, symptoms of problems, when to get a nurse, and the importance of hand washing and when to speak up. And we cover kind of all of this in very quick, short phrases, and we try to wrap it in very kind, images, very soft and very nurturing, a little bit of whimsy as well to appeal to the human spirit. This is the flip side of it, where we ask patients' families to help wipe out germs by specifically wiping down all of the areas that are shown in the checklist. But on the far right column is actually, these are tear-off coupons. And one of them is for, we call them anti-germ wipes because, as you know, we try to get everything down to actually fourth grade literacy level if possible. And antibacterial is just one of those words that doesn't pass the sort of the fourth grade test. So we call them anti-germ wipes. And I think that says it all. It's like these the wipes that are going to kill the germs. And here's another coupon for hand gel. And then this is a coupon for a nail brush to help. And we on the flip side of the coupons, we explain what they're for. And these are all tools for keeping the patient and their environment as germ-free as possible. Then, and as just a grace note, we have another coupon. And these coupons, I should say, are meant to be taken up to the nurse's station, and if they feel like they do want to do the wiping and do their antimicrobial stewardship, if you will, they can get these supplies at the nurse's station. Or in the case of one hospital, they'll probably be at a kiosk. But then we finally give them a coupon for a beverage in the cafeteria, coffee, tea, or whatever, just as a little thank you note for being part of the team. So this is the way for us, we're following that rubric of head, heart, hands. Head facts, heart, the grace notes of thank you, we appreciate you, and the sort of the warm imagery. And then the tools, obviously, are the coupons for actual products. One of the things that we also ask for that should be on every checklist is access to antimicrobial foam or gel. And it's also on the checklist that we present, which is make sure that your loved one's hands are kept very clean. I just use Purell as an example here of a gel that can be on the patient's tray table. It doesn't. One of my best friends had last rites administered to her during the birth of her first child because she had picked up MRSA in childbirth, and she nearly died. A few years later, she delivered another child in the same hospital, and she was very nervous about it, understandably. And when I came to visit her, she was in this absolutely lovely, gorgeous, huge room. And despite her concerns about infection, the only way for her to be able to wash her hands herself before a meal or was to walk all the way across this room. Not something that you can do particularly after her. She had a C-section. So every single patient really needs to have access to antimicrobial soaps. And this is the clearest example that I can give of a simple tool that can be just put on the patient's tray tables or bedside. It's cheap, it's easy, and it definitely sends a message.
Or a white side. I mean, we're not promoting, any particular, like Karen said, it just happened to be pictures of Purell. I know when Catherine was at Kaiser, every tray came with a sealed towel that allowed her to, clean her hands with every meal. And I had not seen that commonly in a lot of hospital practices, and I thought it was an extra step that was given to acknowledge, don't forget to wash your hands one more time you're about to eat something. So there are ways to deliver the safety, and it's just an important factor to remind people about.
Right. Oh, I know. And hospitals have better antimicrobial foams and gels than Purell too. It's just that's what I could grab in clip art. So thank you for bringing that up.
Yeah, clip art convenience.
Also, because it is really hard to speak up and ask people to wash their hands, particularly patients to ask their providers. It's a question that I pose is, so which is easier, to ask a doctor or nurse to wash their hands or to keep quiet? Well, we know the answer to that. It's easier to keep quiet. And this, we have these little tent cards to put out onto tray tables to basically stand up for or stand in for the patients or family members' voices. If you can't say it, let's try to communicate it in another way. And to share these kinds of tent cards with patients and families shows enormous respect and empathy for the vulnerable position that patients and families are in this situation. And this is just how the tent card works. So if we go back to this idea of engaging with head, heart, and hands to prevent infection, the ideal complete toolkit would be is if you could give people the tools, which are the bleach wipe and the alcohol wipes, and you give them some information about what to do with these things. Ideally, if you reward them in some way for helping, for being on the team to prevent infection, and then give them a little emotional support for that speak up, that would certainly be a wonderful way to partner up with your patient's family members to prevent infection. Another thing that we saw, it was absolutely so stunningly powerful when we were doing work at Providence Hospital in Anchorage, Alaska. All of the monitors in the ICU had this message on it that scrolled across the screen. The first part of the message is, because we care about you, it's okay to ask, have you washed your hands? On their screens, it was a white font against a black background, and it was active. You know, it was, I'm sure, I can't scroll on this particular type of format, but I'm sure you get the idea. I thought that black background with the white was certainly very arresting, but I thought, how can we do this in a gentler way? And so that's why we pulled out this graphic, which is the heart against the sky. You could do it however whatever way your own graphic departments could come up with it. But I thought that was such a powerful thing because not only did it give permission, but it was a reminder to the staff that that kind of question is just part of the teamwork for preventing infection. So another thing that we saw is we were doing some work at University of Vermont, and they had an outbreak of C. diff. And what they did is for every meal, they provided really warm, soapy washcloths to the patients to literally wash up before each meal, and it completely eradicated the C. diff outbreak. Now, that was, can you imagine how wonderful that would feel, for one thing? I don't know if you have ever flown an airline. They don't do this very often. On transatlantic flights, I've had this where they give you a warm washcloth just before you're about to land, and it's so fabulous. You almost feel like you're in a spa. It's such a graceful and a real grace note on the part of the airlines to sort of thank you for flying with them, but also to help you feel good about that experience, obviously. So that was such a labor-intensive process, very effective but very labor-intensive. The hospital had to drop it. So after the outbreak was over. But I started thinking about it. How could we do this? How could we get family members to pitch in with this labor-intensive process? So I did a little bit of research and found that Cardinal and Sage both package antibacterial wet wipes in plain packaging that you could have printed and put instructions on. And if you have a central location with a microwave, why not provide patients' families with antibacterial wipes to throw in the microwave and bring back to their loved ones, not just at mealtime, but any time maybe when they might need a little pick-me-up. And this would require some logistics on the part of, every unit to make sure that a microwave is available. But that would accomplish so many different things. It would be yet another way to help prevent infection. It would help patients and families feel useful and feel good, and the benefits of obviously this kind of stewardship and this attention to cleanliness would have an effect on preventing infection. As a final note, we in preparing this, we're constantly thinking about how to elevate conversation, how to advance conversations between patients and families. And on the topic of infections, when I say elevate conversations between patients, families, and providers, and when we talk about infection, it's a particularly tough conversation. Nobody at hospitals in general really don't like to lift the skirts and talk about infection as a byproduct, as a potential byproduct of a hospital stay. Yet, really, it's no different than being in a school, for example, when there's an outbreak of flu. Everyone needs to have all hands on deck, literally, to be cleaned in order to prevent the flu from spreading from student to student. It's the same way in hospitals. Hospitals are public places, and they have, they have lots of people carrying germs in. And I guess what I'm trying to get to is that I would love to see the defensiveness melt away, and for everyone to feel like it's okay to talk about these things, and it's okay to share information and resources in a very natural way. So this idea of getting radical, getting to the root of the problem, which is communication. We know that from the study that was recently published that we've been talking about safety tools and we've been talking about checklists, but fundamentally they aren't enough to save lives, as the study has shown. That it's yes?
How are you?
It's the communication that's also necessary as well. That it needs to be okay for everyone to speak up, including providers, among themselves and between themselves and patients and families. So we came up with this idea to have a courage campaign. And I'm just throwing this out there as something to possibly think about. And that is, what if every member of a hospital staff signed a pledge that when they sense a misunderstanding or potential error in patient care, that they have the courage to speak up. And that on the flip side of this, that if I am questioned as a provider about my decisions or practices, that I will say thank you with grace and respect, and that I will pause, reflect, and take corrective action if necessary. And that if every care provider signed this pledge and they all had a little button that says, hey, it's safe to talk to me, I feel safe in talking to you, that all sense of blame or sense of defensiveness might have the opportunity to fall away, and that a collegial, collaborate spirit, the same kind of collegial, collaborate spirit that I do believe lives in every medical student or nursing student's heart, would have a chance to rise up. Now that sounds very, very, I realize, very idealistic. So I'm wondering, what do you think about this idea? Is this something that you would ever like to do? Would you like to take the pledge? Could it work? And again, this is not something that Boris or Mary or I are saying is a campaign, but we have a lot of these pledge cards in our office. We printed them for a conference, and it's been the subject of discussion at several conferences so far, so I thought I'd bring it up with you, because on the topic of infection, communication is so key. What do you think? I'm throwing it out for discussion now.
Your lines are unmuted, so you should feel free to just simply speak up and say who you are, an organization, and make a question or a comment.
About anything that we've talked about today.
What do you all think of this pledge idea?
Good. Come on, I know you guys aren't shy. You care about safety. Well, this is Mary. I'll fill the silence while some folks do. I think you're working on unmuting your lines, or maybe the chat's working and the lines are not. Anyway, Karen, I actually this is very controversial, and so I'm not for or against it. I'm glad you're asking. Kind of like a focus group here. Would this work? Would this change anybody's way of working and acting? And I recall Jeff Cooper, a physician who was really a leader in anesthesia, taking on the safety concerns that they had in their own practice. And they were one of the first segments of medicine to address, human factors issues and what lines were what colors, and people were dying in surgery from bad anesthesia. Anyway, he gave this story one time about, in healthcare, we don't allow people to, speak up or correct us. And he said it's not unlike driving with your loved one. And, when they say you forgot to use your blinker or you didn't take the right turn, instead of, lashing back out at them, that you have the atmosphere of permission to say, hey, we're in this together. We get there safely and on time at the same time. I'm here to help. And it's not an insult to you that I've identified that you forgot the blinker or you missed the right turn. And instead of just, lashing out, you say, thank you, thank you for reminding me. Now, I work on this every day, I have to admit. But I think in healthcare, we've got this new, I asked a bunch of students the other day at UC, would you be comfortable if your coworkers asked you to wash your hands? And not everyone was comfortable. They were very honest and said, no, it wouldn't be something I'd like to have called out publicly. So whatever strategy we develop, we'd love to hear your thoughts on this particular one, but also just on, whether you've used different ones that may have been effective. I see Kim is typing, so I think we may have a phone issue going on.
Do you guys have any anybody willing to share any examples from your work in your organizations? How do you create that organizational culture, or what are some of the things that you may have tried to do to help promote the culture in which asking a colleague, have you washed your hand, or is met with not so much defensiveness but kind of a normalization that we're all a community of people who care about each other and care about our patients, and in the name of that we are going to help hold each other accountable, where this is not a punitive measure or seen as something that you bristle upon, but rather a collaborative, cooperative thing. Does anybody have any thoughts or examples?
Can you guys hear me?
Yep.
Yeah.
Yes.
Okay. So this is Martha, and I work with the HQI. And this is interesting. I will share with you, excuse me, a number of years ago, I was on a medical mission in South America. And when I went on that mission, our name badges had our name and then what category we were, whether we were a nurse or a doctor or whatever. And then it had a big, 2 to 3 inch sign that said, ask me if I washed my hands. And it said it in English and it said it in Spanish. And I thought, wow, at first, when I was getting oriented, I thought, wow, this is pretty intense. And so I was like, that's because this was probably 10 years ago. But by the end of the, mission, it was like, I was like, that's great. It was a nice reminder to have it around my neck every day. And certainly, and maybe that just increased my awareness so much that I was doing it so much. But when I came back here to the States and I shared it with the colleagues that I was working with, it was not well received at all. And so it goes back to the culture. While I think something like this is great, I don't think our culture here, just as Mary just shared, some of the students were honest enough to say, don't tell me. I don't think our culture in the United States really promotes that kind of transparency, and that's sad. And that's what we're all here for. That's what we're doing. But philosophically, I think this is great. The question is, how do we get there?
Would anybody like to contradict Martha?
Thanks for it.
No, actually, I think that's why, it is very idealistic, but I think in the name of safety, we have to exercise some idealism and act on it. I don't really feel like we are going to make much progress until we get to the root of our communication problems. And Kim, her note. Kim, I wish you were. Are you on mute or?
Here, I'm here. I can talk. Can you hear me?
Good. Thank you.
And
yeah.
Let's be mindful of the time. Let's take 30 seconds for Kim, and then we have to wrap up.
Okay.
So I do work across the country with a lot of hospitals too, and I will agree with Martha. I think I have seen hospitals successfully do it. Well, I say successfully in quotes, have a badge or something like that says "Ask me if I've washed my hands." The issue is that unless there is a leadership culture from the top down that supports the ability for others to be able to speak up, amongst yourselves and to those who are in that authority gradient above you, it is difficult. And if we're only putting the onus on hand washing on nurses who have the badge, that also we really have to work to make sure that it's organization wide, because there are lots of other people who come in the room too. So I do like the badge idea.
Absolutely, it's got to come from the board down. It is a culture.
Yep.
Mm-hmm.
I had this is Mary real quickly, Boris, I know we're wrapping up. I gave a talk about this one time, and someone said that they had worked out a strategy of a safe way to say something to someone, and what you would do is you'd go up to someone and you would sing happy birthday. You'd start to sing it, and that would be the signal that they noticed that you hadn't washed your hands. And rather than in front of patients and families, maybe potentially embarrass someone, and that's exactly part of our culture, that we feel embarrassed when we're called out, that was their way of signaling it. And I thought it was kind of a safe way, and, they had actually worked it through, tried it, tested it, and they felt it was an effective intervention. So, maybe with our culture isn't supporting the direct approach, an indirect approach or a card like Karen's pledge, not Karen's pledge, but a pledge would go a long way, because I know those signs of see Martha, you were absolutely right.
Interesting. Very, very great conversation, guys. Thank you for chiming in. And we could actually, even though a lot of people were silent, we could be continuing to talk about this. It's a very rich topic, and there's so much to exchange and learn on this. And obviously, we don't have a patented solution yet, but we have no shortage of ideas and certainly motivation. And there's great reasons for why we need to continue conversing about this. So, before we sign off, I would like to just make sure that you have the screens here that shows eval SurveyMonkey. So if you click on that, it will take you to a SurveyMonkey for evaluation of the webinar today. Again, this is important for us to be able to award continuing education credits for those of you who are seeking. So make sure that you do it. Again, our coaching calls are here for you. Feel free to call ASMA to request one. Our next webinar is on June 16th. We're going to talk about partnership to prevent falls. And that's about it. With that, Karen and Mary, any parting words?
No, I just want to thank everyone for their hard work and Boris for guiding us through this important agenda.
Thank you so much. I would end with Karen.
I second that. Thank you.
Great.
And thank you all for coming and for being the stalwart group that you are that show up every month. We really appreciate it and would love to hear more about your work. Anytime you want to pitch in on one of the calls, Barton is next month, but we have openings in July and August. If you want to bring to the group things that you're working on, we'd love to hear about your progress too.
That really enriches this work because it's really your contributions, definitely.
Yeah, thanks, Scott and Sharon, for coming today with and sharing your discharge folder.
And I thank both of you, Karen and Mary, for being here with us and enriching our conversation and leading us in this area. And thank you to Sharon and Scott and others at Cottage for the bravery of sharing something that's a work in progress but has great potential. And thank you all for attending, and have a great day. We'll see you in June.
Thank you. Keep cleaning. Bye-bye.
Yeah.
There you go. Bye-bye.
Bye.
Bye-bye. Take care.